Hi, everyone. So my name is Filip Meheus. I'm an economist in the Economic Evaluation and Analysis Unit at WHO. Just to give you a little bit of my background to understand as well where I'm coming from and what my expertise is. I'm certainly not a financing expert. Blended finance is also one of the first times I'm exposed to the topic. I know the theoretical basis of it, of course. So in our unit, we work primarily on priority setting and health technology assessment. So basically, how to identify which services should be included in benefit packages within low and middle income countries in the context of UHC. So we provide primarily country support to member states in developing institutionalized health technology assessment systems, whereby the decision-making process is embedded within country-level structures. So yes, as Maribel said, so there has been a survey that has been conducted on the availability of cancer services. If I hadn't known the question on beforehand, I would have popped up some data and prepared a little bit better of it, because it's the cancer team who actually did the survey. But as Maribel says, it's true that while diagnosis has a relatively good or bad, whatever perspective you have in terms of coverage, it's actually the treatment which is very low within countries. So while you have diagnosis, you don't have treatment actually afterwards. I think one of the main challenges that we've seen is primarily related to human resources and the current capacity within these countries in terms of the available human resources to actually do, in the case of cancer, to do the diagnostic workup as well as to provide treatment services. And that's why we had a very good comment just before the break from our colleague on the supply chains and the strengthening the procurement systems as well. I think it's the same for a lot of the basic building blocks within health systems in low and middle income countries, is that there's still a lot of work to be done with that respect, both in terms of the health management information system, but I think primarily the survey has shown that the human resource availability and capacity is very limited to actually implement very advanced, that doesn't mean that it cannot be done, of course, but the availability is very limited at this stage. So yeah, that's a little bit from my side.